Hello and welcome to the Art of Being Human. On the last segment we talked about frustration and aggression and how frustration can lead to aggression. The one thing I did not describe because I think I ran out of time was inward aggression and outward aggression. There is a difference between the two. You know, they say in terms of muscles that every exertion that you have of a muscle requires that the muscle have an equal amount of rest. Well, in this case, every emotion that you have has to be expressed somehow. Now, maybe we're not talking about everyday emotions that are not negative or positive to the extreme. They just are what they are. But, you know, if you have a lot of emotions, you have to express them somehow. And you can express them inwardly or outwardly. And the difference is this. If you express them outwardly, you do physical things and it expresses the emotions. It can even be house cleaning or sports or doing music or art. It can be almost anything. It could be kicking a door, pounding your fist on the table or whatever it is, yelling. But that's outward aggression, and you're really healthier if you have a fair amount of outward aggression because you're not keeping it in. Now, it needs to be healthy. You don't want to be screaming all the time. You don't want to be kicking your door shut all the time. You don't want to do things that are destructive. Murder would be the ultimate in outward aggression. I don't like something, I'm going to express it outwardly, and so therefore you do all kinds of things that you should not be doing. But there are healthy ways of doing it. I've mentioned before the arts, sports, the different kinds of exercising, you're going on long walks, all of that stuff, creating music, creating any kind of art. There's all kinds of ways to express emotion outwardly. Inwardly is not so helpful. If you express your emotions inwardly, you keep them bottled up. And what happens if you keep them bottled up? You start getting sick. You can have ulcers, you can have migraines, you can have arthritis. Now, the thing is, there are other things that cause those illnesses. So I'm not saying anyone who has arthritis or anyone who has ulcers has a problem because they're inwardly aggressive. I'm not saying that at all. But it is one of the things that can happen. And the fact is, your emotions can influence what your body does. You are a complete system, and you are a system that's integrated, and you are a system that works together. You can't take people and put them in little boxes. These are the emotions. This is the physical. This is the heart. This is the stomach. This is the spleen. And they do this and this and this and this. It's all inwardly. It's all kind of works together. What one part of the body does, the other part of the body responds to. You are a whole system. But if you are using inward aggression, you're holding everything in. Nothing really gets expressed, but it has to get expressed because that's the nature of what we are as human beings. So the body takes the hit. And you end up with illnesses. Now, this is a true story of a woman who had arthritis. She had it really, really bad. She was in a wheelchair. And it's a true story. It has nobody that I knew specifically, but it's just an example of what aggression will do. She had this arthritis, and she was angry at her husband. Well, she had counseling, and she got to the point where she forgave her husband, and everything was fine, and her arthritis went away. She didn't have any more pain. She could walk around. She wasn't in a wheelchair anymore. She was like everybody else. She could walk around, she could talk, she could do normal things, and she wasn't disabled. Then she lost her sense of forgiveness, lost her sense of letting things go, and she started to build up resentment again. And what happens? She was in a wheelchair again. She had to be pushed around from here to there. She could barely walk. She had a lot of pain. But what she was doing is she was holding in, bottled up. She never got rid of it. She allowed it to come back. At the point where she could get rid of it, and she could be forgiving, and she could just let it go, she became well. And then she turned around and decided to become resentful again, and she held everything in. And she wanted to punish her husband. Why, psychologically, how did she do that? Her body got the arthritis again. He had to push her around in a wheelchair. She was just as bad off as she was before. So there is a link between how you feel and what you do and what your body responds to. So outward aggression is more healthy than inward aggression, but you have to be in a controlled way. It has to be in a controlled way where you're not hurting anybody else and you're not hurting yourself, but you're letting it go in healthy ways, in creative ways, and you're getting that out of your system. Those emotions are getting expressed in an outward way, but in a healthy way. And if you're inwardly aggressing, then your body's going to be affected by that. The organs are going to have trouble with that. And so therefore you get developmental, you get diseases and illnesses, and that's not helpful. So you have to change the way that you do things. Now with therapy, anything that you've got bottled up is with a good therapist going to come out in a healthy way. Not before you're ready, but in a gradual way, in a healthy way. You know, in therapy, there is such a thing as pushing too hard and getting loss of control because of the fact that you're expressing emotions that are too deep for you and you're not ready to do it. So it has to be done carefully. Any good therapist is going to help people remember things and express things that they haven't expressed before. But it has to be done in a careful, managed way. It can't be in an explosive, fast way. You have to be ready in order to do it. So you get the emotions up and you get the feelings up and you get the memories up in a gradual way that is helpful to you but not injurious to you. You know, if you push too hard, sometimes you could get too much too soon and the person's not ready to take it. The brain allows you to remember what's comfortable for you to remember. And as you remember more and more, as you start talking more and more with a therapist about your problems, you're going to remember more and more. And that's okay. That's one of the goals of therapy, is to help you to remember that which has been repressed. If you repress, repression is forced forgetting of things that happened to you. But the problem is you remember it subconsciously because the brain doesn't forget. But your conscious mind forgets. Your memory gets pushed down into the unconscious. And then what happens is you have problems because everything's repressed. So you have to bring it up for health. But if you bring it up for health, it has to be done in a gradual way. And so therefore you don't do too much and you don't get too much in trouble. You just express it, it's gone, and then therefore you're a much healthier person. Outward aggression normally is better than inward aggression, in which the body does something or the body becomes ill because of it. Now there's a lot of interplay here. You don't want to outward aggress to the point where you're damaging yourself or hurting somebody else. You don't want to inwardly aggress to the point where you're injuring yourself and you're getting managed diseases that are psychotherapeutic because of the fact that your body is taking it. So therefore it has to be gradual. Therapy is an interesting thing. I do therapy, or have. I'm retired now, but I did it for years. And the idea is to help a person know what they need to know. With analysis, they want you to know everything. And it's a long process, and they want you to remember everything. I don't think it's necessary to remember everything at all. I think it's necessary to remember enough to see a pattern of things. If you have had a history of abuse, I don't think you need to remember all of the abusive situations you've ever been in. But you need to remember enough so that you can see a pattern of abuse, and then you can work with it. You can work with it without remembering everything, and you can heal from it. And there are a lot of healing methods. There are some people who can't do talk therapy because their minds aren't geared to it, and they can't express themselves that well with it. But there's all kinds of healing opportunities, all kinds of things you can do for healing. With children, Talk therapy doesn't work too well with them because they don't have the verbal skills they need. So you use play therapy instead up to a certain age. And play therapy is very helpful, and you can see the way that a child plays, what they've been through, and the members of the family that have caused it, if it is a problem within the family that's caused them to become ill. And you know, you have dolls, mother dolls, father dolls, sisters, brothers, older sisters, younger sisters, older sisters and brothers and so forth, uncles and aunts, and you have dolls which represent all of those things. So you can have a playhouse, and you can have a doll for every member of the family. And the way the child reacts to those dolls and plays with them and what they do gives you a real picture of what's going on in the family. And then you can talk with them, and then you can play with them, and then you can do exercise with them. And so therefore, when I say exercises, I mean little play groups and things like that with them. And then they can heal. And elderly people, they need to have special care in terms of healing as well. And people who tend to be psychotic, they have to have special things to heal. So it's not a case of you sit in a room and you just talk and you just talk and you just talk. That's part of it, but that's certainly not all of it. You have to need to know when to talk and when not to, and what to say and what not to say, and when you say it and when you don't say it, and you get ideas in terms of what a person's problem are, and you can do certain things, help them to become participants in certain activities to help them to heal. So, and medications, that has to be done by a doctor, of course. If a psychologist without a medical degree would not give medications, but doctors will. And so psychologists and counselors usually work with psychiatrists who are doctors, or family practitioners who are doctors, in terms of what is the medication that's best. You don't want to have a person remembering too much too soon, and one of the purposes of having medication is to even things out. So when they do remember, they don't have to go into a psychotic reaction because it's been too much, because they've been medicated so they can handle a lot more. And gradually, over a period of time, a person gets well. Therapy can be slow, but that's all right. It has to be slow, because it's not safe to be fast. And remember, it takes years for a person to get into a really bad therapeutic situation. It takes years for a person to become mentally ill to the point where they need therapy. So it's going to take some time to get them out of that to become normal. And I'm not saying it takes as long as it did for them to get into the situation to begin with. It's a lot less time, but it still can be a long process. It depends upon the illness. It depends upon how they react to therapy. It depends upon their age. It depends upon how their brain is geared. Are they verbal? Do they just sit and stare? Do they do things that is activities better for them? Sometimes people can only do the medication without the therapy, but it's usually better if they do both. Usually the results are better if they do both. So anyway, I'm just mentioning this because inward and outward aggression are important in the way that a person reacts to stress, and also in terms of their health. Well, let's take a look at the brain. The brain is an organ like any other organ. What can it do and what can't it do? You know, the brain is an organ like the stomach and the liver and the spleen. They do what they need to do if they are well. The heart pumps blood. The kidneys filter blood. The pancreas makes insulin and also a lot of other digestive hormones. And they all have separate functions, and they all have to have the same thing. They have to have a healthy blood supply. They have to have nerves. They have to have hormones. They have to have good nutrition. They have to have oxygen, all of that. So the brain is important because it helps us to learn, to think, to remember, to feel. All of those things are important. But the brain can't do everything. We ask the brain and expect the brain to do what it can't do. We expect to think our way to health. We can't think our way to health. Now, we can do things to help the brain in order to react to emotions and react to stress, but we can't think an illness away. We can't think an injury away, but what we can do with therapy is to help the person to adjust so that it doesn't have to haunt them. There are ways and helpful ways for a person to manage and to get rid of anxiety, too much anxiety, depression, and so forth. But when it comes to an illness, you can't think it away. One of the reasons that people have so much anxiety and so much stress that they need help is the fact that there are other things going on in their bodies, and there are things that they remember that are hurtful, and they've been through traumatic experiences, and they haven't been resolved. And you can't just ask the brain to resolve it without help. The brain will help you to resolve it, but you can't think it away. I'm thinking specifically about menopause because women struggle with that. And some women go through menopause and there's not a real problem with it. They don't have many symptoms. But other women have terrible symptoms. Their estrogen is low. They get panic. They get nervous. They get anxiety. They get depression. Sometimes they get almost paranoid. They're afraid all the time. They feel pressure in their head. Sometimes their vision changes. Their body certainly changes. And sometimes it's really terrible what they go through. And the usual course of treatment, of course, is to give them estrogen, and it brings them out of it. It brings them out of it because that's what the body needed to begin with, and the symptoms come because they don't have what they need. As they're going through the menopause, the estrogen drops and drops and drops. So by the way, men go through it too. It's not just female, but it's basically female. The difference between the male menopause and the female menopause, and the reason that the males don't go through it usually in the same way that the women do, is that they don't suddenly drop. That their androgens, their male hormones, don't suddenly drop. It's a very gradual process, and their bodies adjust to it. But with women, many times they drop quickly, for they have enough estrogen and suddenly they don't, and they get all kinds of symptoms as a result of that. You can't think the symptoms away. The symptoms are there, and it's caused by the fact that so much is changing in the body. It's not just the brain saying, oh, you need more estrogen. It's the whole body system. What's going on? What happens if you have too low estrogen and the body wants it and the body requires it? This is why giving the estrogen brings them up. But the problem is estrogen sometimes causes cancer. So I've read. I've also read that it doesn't cause cancer, but take your choice. You can have symptoms either way. So it's a balancing act as to what you can do and what you can't do. So people who have different illnesses, I use menopause because it's an obvious example. They need the physical treatment to make their bodies in homeostasis again, in balance again. They need that. And in addition to that, they may need something extra. They may need extra medication. They may need extra help in terms of therapy to get them through it, because there are psychological things that are going on too. So whenever you have psychological problems, depression, anxiety, things like that, I always look for a physical cause. And what I would do when I was practicing, I would require that the person who was seeing me for therapy go to their primary care physician and see if there's any possible physical reason that they're going through what they're going through. Case in point, I saw a person who was a pastor, and he came to me because he was no longer happy with his choice. I wished I wasn't a pastor. I used to think it was a good profession. Now I wished I wasn't. I'm depressed all the time. It just isn't working out. I think I need to leave the profession. I think I need to go and do something else. I don't think there's a calling on my life. And on and on and on it went with all kinds of things going on. And then he said something significant. He says, and you know, I'm thirsty all the time. And I says, wait a minute here. You're thirsty all the time? Yeah, oh yeah, I really am. I'm thirsty all the time. And I said, you're going to a doctor today. and you are going to be checked for diabetes today. Now, I might not have thought too much about it, but being diabetic myself, I know what the symptoms are. And the problem was his sugar level was sky high. As soon as they started giving him insulin and showing him how to use it and treating that, he came in and he says, you know what? I feel so much better now. I really love what I do. I'm so glad I made the choice. I'm glad I didn't leave the profession. And we all knew what it was. He had a physical condition. He had diabetes, and it was way out of control. And it was causing him to think in a real negative kind of way. Now, if he hadn't said, I'm thirsty all the time, I might not have caught on to it right away, but I would have caught on to it eventually, because I always have clients see their doctors to see if there's a physical thing going on that could cause their emotional symptoms. So you can't think away the emotional symptoms, but you can get checked. And if it is something physical, once that's handled, once that's taken care of, what happens? You feel so much better that you don't need the therapy. Or you may need some therapy, but it's not as deep as what it would be if you hadn't had your physical nature checked. I mean, I've counseled women a lot, more so than men, although I've counseled both men and women. And I always checked to see if there was something physically going wrong, and if there was something that was just off, like the thyroid could cause you to be terribly nervous if it's off. And so I made sure, since I'm not a doctor, that all of that gets checked out. And then when that's checked out, and we know that that's not causing, a physical reason is not causing medical or emotional changes, then we can go on with the therapy, and we don't have to worry about, is this something doing this? Remember, the body acts as a unit. You are a whole. You're not different parts that are patched together. You are a whole. And the brain is expressing what's going on in the body. And you can't, until you change what's going on in the body, you can't change what's going on in the brain. Now, a lot of mental illnesses need medication, especially the psychotic ones, because the hormones in the brain and the brain chemistry isn't right. And if the brain chemistry isn't right, you're not going to think right. You're not going to feel right. You know, and you can get some pretty bizarre symptoms. You can have hallucinations. You can have delusions. You know, and so therefore you have to think in terms of what's going on here. And medications are sometimes very necessary to get a person into health. But don't think the brain can do what it can't do. If you're having emotional problems, we need to look at the whole person, not just one part. If you're seeing me for depression, which I'm retired now, so I wouldn't be seeing anybody, but if a person was seeing me for depression, I want to know that that depression is caused by psychological factors that are going on in a person's life, and not because their hormones are off or the biochemistry is off. You have to take a look at everything that's going on, even in the brain, physically in the brain and physically in the body, to make a judgment as to know what's going on and why, and then you can treat it. So it's important to know what the brain can do. It's important to know what it does naturally, but it's important also not to try to force it to do something that it can't do, and then blame yourself because it can't do it. Well, it's my fault I feel this way. I can't stop. Well, if you can't stop, there's a reason. You know, there's no such thing as a symptom without a cause. You have to find the cause. So therefore, just in terms of, I want to bring in the inward and outward aggression, because that's what we do as people. We aggress inwardly or outwardly. And if we're aggressing inwardly in an unsafe manner, the body's going to respond to that. And we're going to get the symptoms of that, whatever it is. And the organ that's the weakest is going to take it the most. It's like a hard hit. So we have to think in terms of that, in terms of people, how they react. And remember, society is very punitive. If something goes wrong, someone has to pay the price. And so we pay the price, and our bodies oftentimes pay the price as well. So we need to get into a healthier situation. And with that, I think I don't have too much time left, so I probably should close with this. I think next time we're just going to go into defense mechanisms and decide maybe you can decide what kind of defense mechanism you use. I've done this before with certain classes, but I think with this day and age and the pandemic, we need to do it again. So that's what I'll be doing next time. Please join me then.